Thank you very much, Nicholas. And can you see my screen?
Yes, this works.
Okay, great. Thank you. And thank you very much for inviting me.
Ken, one quick question. Ken.
Yes.
Just a question here for the audience. Is this okay for you? Will this work? Okay, sorry for the interruption. Ken, please go ahead.
Okay, so thank you very much, Nicholas, and thank you very much for inviting me to the CVPR workshop MCB. Unfortunately, I can attend this workshop in person, but I actually wanted to come to this workshop in person. I checked my flight in just last week, but unfortunately, I cannot come to New Orleans. Very sorry for joining this meeting by Zoom. And I am now belonging to Nagoya University in Nagoya, and also some of the director of the Research Center for Medical Big Data in National Institute of Informatics in Tokyo. So actually, my laboratory is working on medical image processing, mostly 40 or 50 years from my supervisor's time. And actually, we are working on medical image segmentation on the left, showing the left side, and also developing a computer-aided diagnosis system for the colonoscope, which obtained a medical device certificate. Just Nicholas mentioned about it, and also working on the computer-assisted interventions by using the medical image processing techniques, and also the working on the 3D printing things and microanatomical structure analysis. And just 2 weeks ago, IPCAI held in Tokyo. It was the in-person meeting in the computer-aided surgery areas, and unfortunately, I missed Nicholas in this conference room. But Nicholas is now a general chair of IPCAI from now, so I think he can make a big effort for the IPCAI, and we will have a good, successful IPCAI meeting in next year. So as I mentioned previously, I was working on the medical image processing. For me, it is just 30 years experiences. Firstly, I was working on the bronchoscope navigation, and also by using the tracking techniques of the video, and I just synchronized the real bronchoscope with virtual endoscopic images, and made some of the navigation system for bronchoscope. So on the right side, it is showing the virtual endoscopy system, which is created from CT, is moving in synchronization with real endoscope movement. And it is also showing anatomical names of bronchial branches. And this is based on image-based techniques, but now we can do such things using deep learning techniques. So I think this slide shows some of the environmental intelligence medicines. So probably the artificial intelligence will exist everywhere in the medical domain. So please remember this environmental intelligence word in my talk. So here, this slide shows some of the AIs in endoscopic procedures. Of course, the first purpose is maybe abnormal region detections. In colonoscope case, that will be the colonic polyp detections. It may be a noise. Yes. And the second one is maybe a quantitative diagnostic assistance, like in a colonoscope, that is the end-site assistance. And also the AI will play an important role in endoscopic procedure decision support during examination or surgeries. And also the AI will support the medical staff, and also will support the patients and their families. Maybe just giving some information to the patient to accept some of the treatment strategies provided the doctors. So I will show some of the examples of AI things. So in the colonoscope, so this in the this slide shows the basic workflow of the colonoscopic examinations. And the physician inserts the endoscope into the colon through the annals and then they try to find the polyp from the colonic videos. And also, if they find the colonic polyp, they have to decide this is a neoplastic polyp or non-neoplastic polyp. After finding the polyp and deciding that this polyp is neoplastic, so they have to decide or determine this polyp is malignant or not. And after the diagnosis, this polyp is malignant, they have to decide, well, we need a surgical resections or this polyp can be endoscopic resections. So there are many steps of decisions, and AI can support these decisions online. So the first decision support is chronic polyp finding in the real time, and the computer is connected to the endoscope, and the computer detects the polyp online in real time. And if the computer finds polyp, it beeps. And after that, so we can combine such system, with the endosite diagnosis system. So they find the polyp, and we can take the very enlarged views of the polyp surface, and the computer automatically calculates the neoplastic likelihood or non-neoplastic likelihood in real time. And by using such information, the medical physician can decide this polyp is a neoplastic or neoplastic. And also this is everything in real, it's a real time processing. So they can take a lot of images to be processed by the computers, and the computer gives the feedback very in real time, like this way. And computer, of course, the computer can find the polyps that can be easily overlooked by physicians. So in this video, the polyp appears at some point. And probably you can find the polyps at just behind the house sort of forge. And such polyps can be detected by computers like this way. And now the computer beeps, and yes, you can see the polyps here. And also the computer can now make the more complicated decisions. And here the computer is diagnosing images, and it shows this polyp is an invasive cancers, and you have to do a biopsy. So the computer now is suggesting the procedures after the polyp finding. And this system is in the 4 versions. One is polyp detection, and one is a polyp 2 classification, the polyp, and 3 classifications. And the other one is UC, that is extended UC diagnosis, ulcer diagnosis. And I will talk about the next one is I will talk about the laparoscopic procedures. So this is also the one of the big areas of endoscopic assistance or endoscopic image analysis. Laparoscopic surgery, the surgeons insert endoscope into the patient's abdominal cavities, and they will perform surgical procedures by using a forceps. But this requires a lot of surgical skills. So the surgical assistance system that are strongly expected to be developed. One is the surgical planning system, and the other one is and surgical navigation system, and the final one is laparoscopic video analysis. And in such surgical navigation system, especially for the gastric cancer, anatomical structure understanding and the displaying anatomical structure to the surgeons are quite important. So in the laparoscopic gastrectomy for gastric cancer is that is very focusing on the processing blood vessels. So the surgeon has to, precisely understand the location of the blood vessels, and also they have to cut the blood vessels in that is defined by the surgical orders. So the first things that can help by medical image processing is to extract anatomical structures from CT. So that is can be maybe that is maybe anatomical structure extraction of the preoperative CT dataset by using FCN. And one of the example is to utilize the VNet. And by using such a VNet system, so we can extract the anatomical regions from the preoperative CT scans. Of course, you can use a, anatomical structure. You can use a 3D unit or unit plus plus and unit and many methods to segment anatomical structures from 3D CT dataset. However, the important point from the clinical side is to precisely segment anatomical structures from preoperative CT scans. And blood vessel anatomy is quite important in gastric cancer surgeries. So the blood vessel has a lot of anatomical names. And now the graph neural network can be applied to assign anatomical names to each branch of the blood vessels. I will skip the details of this method, but after segmenting blood vessels from CT scans and obtaining a tree structure information from blood vessels and feeding such information to the graph neural network, we can assign anatomical names to each branch of the blood vessels. By using such information, we can create the branching pattern report for the preoperative planning, and also we can provide the some of the anatomical name information on the navigation system of the laparoscopic surgery. And the recognizing anatomic structures on the laparoscopic image is quite important. 3D unit or VNet or other techniques can be utilized for segmenting the blood vessels from CT or from laparoscopic images. Capturing the multi-scale anatomic structure change is quite important in such areas. By considering a multi-scale, it's the size of the blood vessel can changes. Camera is located close to the another blood vessels are far from the blood vessels. So we have to consider the change of the scale of the blood vessels in such segmentation techniques. And this is one of the examples of the left gastric artery segmentation. That is a quite small artery, which is quite important in the gastric cancer surgeries. And the computer now can segment such small blood vessels very stably by using this way. It's based on the 3D unit. And also now is depth information recovery is possible by using a cyclogram or other methods. And this is one of the depth estimation results and shape recovery from the laparoscopic images. Sorry. Yes. Two. And now you can, based on the 3D shape recovery, so you can see the 3D scenes of the target areas of like this way. And that can, this information maybe can be used for the robotic surgery assistance. And the other anatomic structures can be segmented from laparoscopic images. And this is one of the examples of the pancreas regions from the pancreas region segmentation from laparoscopic images. And also the video image classification is one of the big areas of the surgical visions. And the surgery is, is kind of the set of the processes. And the first one, the physician process the left gastric arteries, and then physician surgeons cut the left gastric veins, and that is the flow of the very, very tiny procedures. And now is AI can determine what part is processed by surgeons based on the deep neural networks. And based on the such system is we can determine which area is processed at this moment and what is a good anatomical views for the surgeon which is assisting surgeons. And here the computer is recognize this scene, and the scene levels are shown here. I'm quite sorry for this is written in Japanese, but this is at this under these areas, so the computer is showing which veins or arteries are processed at this moment. And based on the search results, so we are showing the pre-rendered 3D anatomical rendering of this patient. And by observing such images, surgeons can do surgeries. So now the computer is which area is processed, and we are showing the most appropriate 3D rendering for these areas. And here's some of the issues in the medical AI domain. One is database, and one is the data imbalance, and the computation resource, and regulation, and privacy, and ethics. And it's shown in process, that is a FDA process in United States takes a lot of time, and normally it takes 6 or 5 years. So this is a regulation the problems. And the computation resource is quite also important for the medical computer visions. This is a computer that is located in Nagoya University, and this is supercomputers having many GPUs, and we can use such computation resources for making AI systems. And currently, I'm belonging to National Institute of Informatics. This institute is collecting medical images from the many hospitals by Science 6, that is academic network. And we have almost 300 million CT images in this server, and we can use such images for AI development. And one of the examples is the lung CT image analysis for the COVID-19 cases. And we are collecting the CT data every day, and we can analyze such data to count the number of COVID-19 cases. And this is a kind of the CT image analysis result. And the federated learning is also the important point for, especially for thinking about the imbalance of the data set. And this is my student work, which is presented at Mikkai workshop in last year. And this one is this federated learning method, but this paper is using several data sets, and we are considering this data set is obtained from different hospitals, and we made federated learnings. And by doing federated learning, so we can significantly improve the segmentation accuracy by using a federated learning. So federated learning will be a very strong tool for considering data imbalance, which that is caused by institutions or hospitals. And also the AutoML, so finding the good hyperparameters is quite important in these areas. And also now the AutoML can be utilized for such domains. But AutoML is finding hyperparameters of the network automatically, but it takes a lot of time to compute. So the proxy, we have proposed a proxy data selections. So we are not using all of the data set for the AutoML. So, but we can find we are eliminating the number of the data set that is used in the training process by eliminating the similar data set from the training data set. And such system, by using such systems and AutoML can find good hyperparameters for segmenting the anatomic structures from CT images. And finally, so I think the environmental intelligence in the medical field is quite important areas. In the future, AI will be everywhere. So the AI will exist with medical staff. Maybe they are just co-workers. So I think we have to make some of the technologies or methods for that can coexist with medical doctors in the future. So and that is, thank you very much. That is all. Thank you very much for joining my talk.